Thank you everyone for joining us for the March 2022 session of the BrainX Community Live. We do these on a monthly basis. So if you're joining us for the first time, welcome. For those who are joining us for the first time, I'm going to give you the background for BrainX Community. Well, it was started with the idea of machine learning in healthcare for good, and we wanted to share scientific information. We wanted to create a platform where we can all collaborate. We have had 3+ very successful years. It's grown to be a 4,000+ member international community. We have a very strong and active LinkedIn group with more than 2,000 members. Our website has been recently updated with brainxai.org, so please visit that. And then we do these monthly live sessions over here where we have invited speakers sharing their scientific work, and we get an opportunity to learn from them. So again, a preview of the website. You can go to it, and we refreshed it recently. You can go to the home page, and there is an update section where you can find the latest information or the latest updates that we have made over there. And then we have the connect section where the information regarding these monthly events is placed. And if you miss those events, the link to our YouTube channel is also available right through that. And again, you can subscribe to our YouTube channel so that once we have the recording placed over there, you can get a notification of the recording and you can watch it in case you missed that particular event of your choice, or you can watch some of the older events too. As I mentioned, a very active LinkedIn group. We share a lot of scientific information, so please join us there. And then we have the popular learn section where we have a list of links to the curated articles which have been of great significance. These are categorized based on different specialties so that you can look at the healthcare specialty of your interest, and that might help you with your research. So there is a filter option on this learn page. And then we are always looking to follow with the rising number of publications, as we'll illustrate through rest of this event. There are some journals which are very focused on AI in healthcare publications. So you can get the list of those journals and follow them through us. And we created a new section, which is books. And there are quite a few publications that are coming around. And you can get the latest and the greatest right through this. So you could filter the learn section for books and see some of the latest publications in this area. And one of the most popular sections is the data section. Everybody is looking for open source data sets. We just recently put out 6 to 7 open source data sets that are there. I'll be sharing that information soon. But the data section is also similar to learn section, classified based on healthcare specialty. There is some information about the healthcare data sets that are open source that is posted over there, and there is a direct link. So you click on that and you can directly go to the data set. Typically, they have some minimal requirement or minimal agreement requirement, but you can utilize them in a very short time frame. We also started our podcast series last year, and we have featured many experts who have been applying data science or AI in healthcare. So if you want to listen to their journey, listen to their experiences, and learn about what they're working on and what their vision for the future is, please subscribe our podcast. It is available through all different key podcast channels like Apple, Spotify, or Google Podcasts. So you can subscribe those, and the latest podcast, once we record it and put it over there, will be available to you. Again, looking beyond COVID, this year we are looking to reconnect. Some of the meetings give us great opportunities to reconnect and learn. If you go to the meetings section or the conferences section, you can find a whole host of meetings that might be of interest to you, all in one location, and let's connect this year. And that brings us to the key topic for this month's event, which is the 2021 year in review. Again, this would not have been possible without the help of 30 plus co-authors. Special thanks to all the co-authors who helped create this exhaustive document. And we put it on ResearchGate just 2 weeks ago, and we already have 2,500 plus reads of this particular article. Just shows you the hard work that has been put in there in curating all the information being made available is of great value and is deeply appreciated. So to begin with, I'll start off by giving us an idea of why we needed to do this. We have seen that year over year, there has been a growth in number of publications related to AI in healthcare. And there was a need to have a curated and classified list that is readily available so that you can plan your research, you can add to your research, you can get started with some ideas, also see who is doing what in their field. You can learn from other specialties, and that was the impetus for us to create this publication. It also gives us an opportunity to showcase the work of key authors and researchers that gives you an ability to connect with them directly. So it's not just about the title or the publication, but also who were the co-authors and representing them well in this. Over the years, we have included various specialists who have joined us today, and I thank you for sparing the time, not just for the publication, but for joining us today. But they have provided their viewpoints. So if it's about GI, we have a gastroenterologist who has provided an editorial regarding that. If it's about cardiovascular, then we have had a cardiologist provide an editorial regarding that, and also try to provide us with the top pick article or the top choice articles, and that gives us an idea about what they really liked and what happened in their specialty. And a great diverse group of co-authors that brings in a special value to this publication. And again, also doing this year over year provides us with the trends for AI in healthcare. And this has become better and stronger as we have done this each year. So methods, we have kept it very simple. And I'm sure you can argue that there are other search methodologies that we could use or other methods that we could use, but we have kept it very simple. Just an initial PubMed-based search for artificial intelligence and machine learning. It's for the entire year. We have restricted it to human and English just because it's hard to do it otherwise. So yes, we lose some really good publications through that, but I think it does make it simpler for a lot of us to curate it. And then we go about curating, classifying, and verifying these publications and making sure that they are classified correctly. Now, approximately 5% of these publications are classified in multiple specialties. So for example, if there is a publication related to AI application for colorectal cancer using CT scan, you can imagine you could put it in the oncology specialty domain, or you could put it on the imaging domain. We do use some of our own expertise in determining where it should go. I looked through what the focus of that particular paper is and try to put it in one specialty versus another, but sometimes you can't. So it goes into to two or sometimes more specialty domains. That's possible for few publications. So as you can see, again, this slide provides you with the results. So it gives you an idea about the total search, which is on the far right. And you can see year over year how many of these publications have resulted just from the search itself. But then subsequently, the middle slide represents the exclusions. They have been excluded because they didn't belong to AI or they didn't have enough value. They might be just certain correspondences, very limited correspondences, or sometimes there are just errors in the searches that might lead to them being there. So those are the exclusions. And then on the left side, you can see the total, which is the final list year over year. So you can look at on the far left column, the gray one represents 2020, where there was clearly a large number of publications, but the 2021, which is in the dark yellow or light orange, that represents 2021. And again, then we provide the same information based on specialties. And you can look at the trends for different specialties through this particular figure and how they have grown every single year and what the trends have been. And of course, you can see radiology and oncology are the leading specialties in this. General is a potpourri, a mixture, especially containing some of the reviews, some of the systematic reviews or scoping reviews, not necessarily related to a particular specialty. It also has a lot of publications that are related to drug development or medications. And again, we provide the numerical trends too, not just the graphic trends, but also the numerical trends for each specialty so that you can look and compare year over year for the same. And this year, we also added trends for the top 10 specialties. We want to see how they're performing. And this is based on the cumulative total. That's how we decided on the top 10 specialties. And you can look at the trends over there. Again, 2020 was an odd year out where there was a high number of publications. So compared to 2020, there is a slight dip in 2021. But if you look overall, the trends are still very much maintained across from 2018 to 2021. Again, there are limitations to this. Surely it's not a exhaustive search. So it is PubMed based, and we could argue that we could add a lot more, but we wanted to, first of all, stay consistent, cast a broad enough net, but stay consistent. The idea is not to capture every single publication, which we would love to, but is challenging sometimes. And keeping it consistent makes it comparable year over year. If we change our methodology every single year, then we would not be able to compare the trends either. So we have tried to stay consistent year over year. As I mentioned, it's English language only, so we have a limitation with that. And again, the limitations of the search. So apology for missing your article, or if you missed a special article that you really, really loved. We did give the liberty to our expert authors to include it in their review. So there might be some articles in the review that they thought were of relevance but got excluded or were not included in the search or not captured through the search, but they get a special mention through their reviews too. Trends, as I mentioned, that there was a decrease in number of publications in 2021 compared to 2020. And we postulated that this might be because journals were very much focused on COVID-19. So there were a lot more number of publications that were being accepted for COVID-19. We would all agree that we have had our challenges with collaboration related to COVID-19. And again, the impact of COVID-19 on clinical research, there could have been possible delays in data collection, especially when you think about like the clinical research where the patient numbers might have dropped in many areas. The study participation might have decreased, and then study approvals themselves might have been delayed for the COVID-19 reasons. And possibly also decreased resources. We have had to work from home. We have had to have our different administrative support being limited because of the difficult years that we have had. Those could possibly be the reason behind a drop that we might have seen compared to 2020 in 2021. But overall, as I said, the trends are still preserved. 2020 just appears to be an exceptional year for publications related to AI in healthcare. We have grown, so I'm really pleased that we have a great, diverse group of specialist authors. We are not 19 anymore, we are 34 in this publication. So thank you all for your contributions, and I can tell you the curation of these articles starts January 1st, and we finalize our publication, including getting the specialist authors to get their reviews in a timely manner. So it's a lot of work on their behalf to put this together. So I really appreciate that. And they are in abstract or editorial format. Many of them have put their article or articles of choice, and we have made the author bios available at the end of the publication so that if you want to collaborate with them, if you want to connect with them, you can reach out to them and explore more. We also changed some of the format this year, where the specialty abstract index, which lists the different specialties, is listed, has links to the section itself. But at the bottom, you can see that there is a specialty abstract index link. So you can always go back to this particular index. So you can go back and forth, and makes it easier for you to toggle through the document. So I'm going to start with some of the specialty sections, going into the specialist reviews. This year, again, the administrative and the quality improvement section was provided by Dr. Avnish Khare. There were 72 publications, and it was interesting to see how there is a big focus on NLP, on speech to text. So a lot of administrative functions to help with efficiency of workflow amongst clinicians. A big focus on social determinants of health. So it's good to see that social determinants of health are making or getting featured in research work, and the data is being collected in a better way. A lot of ideas about clinical decision support and workflow optimization. So that was the key theme for a lot of these articles this year. And the recommended article from Dr. Khare was related to the AI projects in healthcare, 10 practical tips for success in clinical environment, published in BMJ Health Informatics Journal. And that's a great article, which talks through some of the implementation aspects and the challenges that we are faced and how to overcome those. The anesthesiology review was provided by Dr. Scott Siegel, and there were 18 publications over there related to pain, which is a big part of what we do in anesthesia and management of pain, and then hypotension prevention. So a lot of focus on use of algorithms to prevent hypotension in the perioperative arena. Some related to image analysis. Dr. Siegel's work is exceptional in using image analysis for prediction of patients who could be difficult airway or challenging airway. So some work there, and then some related to mechanical ventilation. Again, his article of choice was related to evaluation of biomarkers in critical care and perioperative medicine. It provides a great overview of traditional statistical methods and machine learning algorithms. So it's a great review article to learn about machine learning, not just with respect to anesthesiology, but in general. So would definitely highly recommend that for a read. Cardiovascular, this one was provided by Dr. Jay Nahar. We had 119 publications, and I'm not sure if he's here. I don't see him here, but he might be joining us later. But they were focused a lot on cardiology-related imaging, so echocardiography. As we know that there are now some FDA-approved echocardiography-based algorithms that are already there embedded in various machines. The CT scan and MRI for cardiology is gaining pace. Angiography related and prediction of where either there might be a lesion or diagnosing that lesion using deep learning methods, that also gained a lot of ground. ECG or EKG based algorithms have been at the forefront for quite some time. They've been evolving, a lot focused on atrial fibrillation. there is increasing work related to clinical decision support, remote patient monitoring, some work that is expanding along congenital heart disease and cardiac rehabilitation too. So a pretty wholesome progress that is being made. Initially, a lot of focus used to be primarily on arrhythmia detection, but you can see it's expanding into a lot of different areas. Still heavily focused on imaging, but is expanding into various different aspects of cardiology interventions. COVID-19, we had made it a separate specialty last year, and this year the review was provided by one of the BrainX interns, Raghav Awasthi. There were like 134 publications, a lot of them related to screening, diagnosis, and detection of COVID-19, but a lot of publications also focused on drug repurposing and vaccination strategies or therapeutic strategies. So looking at different treatment modalities, possible drugs that could be repurposed for COVID-19 management, and then vaccines, not just development, but also vaccination strategies. So I do see Raghav over here. Raghav, if you can join us, and if you have any comments related to this. All right, he might be on mute, so I'm going to move on. Maybe he can join us in a bit. Critical care was provided by Dr. Anirban Bhattacharya. There are 24 publications. As you can imagine, sepsis continues to be a big challenge for us, and there continues to be a lot of work related to sepsis-based algorithms. Similarly, for ARDS and related mechanical ventilation strategies and delirium, there are increasing number of publications related to delirium in critical care. One of the things that he highlighted was about the utility of some of these algorithms, because they have, some of them have limited applications, they have their shortcomings based on smaller data sets, and then also the issue of biased algorithms. I do see that he has joined us. Anirban, do you want to make any other comments related to this?
Hey, Piyush, thank you. Thank you for the invitation. No, I think, overall, I've seen that things have moved from the usual prediction to understanding how we can use AI better as a tool in our day-to-day practice. But I think you've covered pretty much everything else.
All right. Well, thank you very much for joining us today. Dermatology was provided by Dr. Frank Pepe, 30 publications. It was interesting that melanoma still stays as the key diagnosis that everybody's focused on. And again, of course, the skin lesion diagnosis is an important aspect of the applications that are being developed. A lot of them still image-based, but also related to disease monitoring. So about the progression of disease, that's something that is interesting and being researched in this area. So not just a spot diagnosis, but also the evolution of the disease itself. But again, challenges there related to bias. Bias as in patients who have different skin colors, patients who might be from different races, and those present true challenges. And of course, the challenges with limited data sets, which is not peculiar to dermatology. Dermatology of all does have quite a few data sets, but again, they're still limited when you think about the context of the diseases that they have and the images that they capture related to those. Education. Actually, this was a great year. Amanda Naylor provided us with the review, 17 publications overall. It was interesting that there were a lot of publications looking at how to evaluate medical literature with ML or deep learning methods. There were quite a few articles that were related to how AI and ML education needs to be incorporated into clinician education. And then using AI-based or AI-enhanced simulation for better training. Especially, we have seen a lot more publications coming around AI-based simulation for surgical skills, and that is a growing area of importance. The special article that she mentioned was exploring the roles of artificial intelligence in surgical education, a lot related to the simulation, and a lot of work going on in that space. So great read, and highly suggest that you look at this. Dr. John Lee provided us with the review for emergency medicine and the great work that he does all the time. He actually provided review for each and every publication. And we are joined by him, so I'm going to let him give us his 2 cents about it. But what I took from there was the quote that he had in there, that they're early in their journey, that is emergency medicine is early in their journey, which I equated to as a great opportunity for emergency medicine physicians. Dr. Lee?
Well, that is a glass half full way to look at it. You could say also that emergency medicine, if you look at the total numbers, is certainly lacking in their numerical presence. Although I think there's 3 main themes. The first is just, and these are themes that I think apply to many of the other specialties. Ingesting and creating some sort of insight into the masses of data and distilling it into a single nugget that is actually actionable. Predictive analytics, which is rampant in many of the other publications. And what we just touched upon, that, and I think this actually applies to a lot of other AI publications, in that there's a lot of stuff going on the actual algorithms and the data science, but we have to figure out ways to actually translate that into things where we can, as the average clinician can actually take advantage of and put it directly into their workflow. So I think those are the 3 main takeaways from the emergency medicine literature.
Yeah, thank you for a great summary. I also want to make a special mention that MIMIC, which is an extensively used data set coming out of MIT Beth Israel, did add the ED edition to MIMIC 4. So there is MIMIC for ED edition of data set that is available now. And again, that is hopefully encourages a lot of our colleagues to research using that available data. So thank you, Dr. Lee.
That is actually great. I noticed that, and I hope to dig into that relatively soon. Thanks.
Sure. Endocrinology, again, this year, 26 publications. The co-authors were Dr. Chaitanya Mammalipalli. If I mispronounce the name, I apologize. Nikita Bozdayev and Johnson Thomas. I do see some of the co-authors over here, so I would love to have them join and provide their summary for this. But from what I gathered, still very focused on diabetes related prediction models, both diagnosis, but now expanding into risk of complications, or predicting the complication risk. And of course, amongst the solid endocrine tumors, very focused on thyroid. Some exceptional work by the co-authors themselves, with Johnson Thomas, who was a co-author on the AIBX publication, going into external validation there. So any additional words or summary from the co-authors here?
I can speak on the thyroid part. We split the work, and Chaitanya could give an update on the diabetes. So in thyroid, it's image analysis through neural networks, mostly convolutional neural networks, and radiomics approaches for the diagnosis of thyroid cancer. I think that's the main theme in 2021, which is similar to the previous year. But I think the field is maturing, and we are getting closer to clinical utility of research work. I particularly like the work of Chinese investigators who developed a TINAT model, which classifies neck ultrasound images, thyroid ultrasound images for the nodules as benign and malignant, primarily because of the size. It was the largest database ever created for thyroid ultrasound images. I believe they had more than 5,000 total cases, which resulted in unmatched performance of their model, which I think very likely exceeds performance of the radiologists who would be assigned a similar task. So I'll let Chaitanya to speak about diabetes.
Yeah, thank you, Piyush, for the opportunity. I think the area of diabetes, there was a lot of review articles summarizing the diabetes prediction models regarding their accuracy, but the main concern with the implementation is how reproducible they are, and so that's main concern. Like, it's not unique to endocrinology, but that's the one concern. And as you mentioned, there's also a lot of work done in trying to predict which patient is going to be at risk for complications, sort of a lot of work in the area of precision medicine. So we can target this high-risk population for specific interventions tailored to that individual. And there's also work done in pediatric endocrinology regarding height prediction, trying to estimate a child's age based upon their height at the age of 6 years. Traditionally, they need X-rays to evaluate this, and it's not done till later in the age. But this is very fascinating to have that growth prediction early into the growth of the child, so that, and this was, the research also showed it was quite reproducible across various cohorts. And there's some work done in the area of gestational diabetes, trying to predict which patients will be at risk for gestational diabetes at early into the pregnancy. But overall, I think exciting developments, but not at the level of still at a practical implementation, but exciting developments to look forward to.
But still looks like thyroid work is exceptional. The benign versus malignant, and thanks to all the work of some of the co-authors who are here, that is making great progress and getting into external validation and then clinical application areas.
I agree, Piyush. I think the field is maturing. There is at least one radiologist support tool which has been approved by FDA for this task, which uses deep learning, artificial intelligence tools to identify risk features on the ultrasound. I don't think that kind of tools will replace us as physicians anytime soon, but definitely can assist radiologists in achieving greater throughput and a greater accuracy in identifying risk features and providing recommendation on the need for invasive biopsy.
Excellent. Thank you again for your awesome contributions.
It's my pleasure. Thanks for the invitation.
Sure. Moving on. This is the specialty that I would call was the rock star of 2021. They went from 81 to 173 publications. And these publications were not just systematic reviews or opinion pieces. These were like real deal, hardcore research publications, a lot of them related to endoscopy and AI-based or computer-aided endoscopy-based lesion detection. A lot of work that has been going on in that area. So last year we saw that 6 RCTs were done involving endoscopy, and that work just continues to expand. And I think they always like to create some kind of a controversy here. The favorite application was AI versus expert endoscopists for diagnosis of gastric cancer. And I do see Dr. Kocher, who's here. He was here. I saw him on the list.
I'm here.
Maybe.
I'm here, Piyush.
All right, Gursimran. So, it was Babu P. Mohan. Both of you contributed to this. Any special thoughts from you guys?
Yes, no, I think this is very exciting times for GI. GI, last year actually we gained our first FDA-approved device for colonoscopy screening called Genius, GI Genius, that can basically you hook onto your scope and it tells you where the polyp is. So we got that approved by the FDA. It's already in use in clinical practice very heavily. So GI is running leaps and bounds. And I think the initial focus for GI and main focus so far for GI has been image detection to improve cancer diagnosis, to pick up early cancers and things like that. But I think in this year and coming next year is going to shift a lot to the operation sides of things, how to optimize scheduling, how to make less no-shows, how to make sure that people are showing up for the appointments to launch in the operations world. But this study, yes, I picked this one because AI scored 100% max. The expert endoscopist scored 98%. So AI was slightly better, but the authors put it as a non-inferior study in picking up gastric cancer. But we are very excited. A lot of RCTs you'll see coming out this year of comparing one modality to the other. So we are fortunate that we started early. Yes, but this is very exciting.
Great. Well, thank you very much for the great summary. Moving on, as I'd mentioned, the general section is a potpourri of various different publications, a lot of reviews, systematic versus scoping, a great summary provided by Dr. Sandeep Reddy, and it just shows the maturity of this space. So going from viewpoints that AI can be used in healthcare, now we are seeing a lot more articles which are focused on implementation and translation aspects of AI in healthcare. How do you go about doing that? And again, Dr. Reddy's very well-received publication regarding evaluation frameworks to guide implementation of AI systems in healthcare, which was published in BMG Health and Healthcare Informatics. That was one of the editor's choice article, and that was one of the most read articles in that particular journal. It just shows how this space is maturing. And of course, there were a lot of articles again this year about application of AI for medications or for drugs and repurposing or drug development. So I would refer our pharmacology colleagues to that particular area, but that again seems to keep on increasing with leaps and bounds, just like we saw with COVID-19, that there was a lot of articles related to drug repurposing. Genetics. So this year, thanks to Shreya Mishra, we were able to get a review for the genetics section for the first time. It had 65 publications. As we very well know that protein structure identification has really been revolutionized using some of the deep learning methods. So that was a big focus for the genetics area. Again, continued work on application of the same in drug development, and then related to cancer genomics or gene editing for the benefit of the cancer patients. So thanks to Shreya, for the first time we had a genetics review. Moving on to head and neck and dental, we had Nathan Brokian and Dr. Andre Burr, who presented us for the first time a review for this particular section. 51 publications, a lot focused on oral cancers, their diagnosis and segmentation. A lot of work going on around radiomics, pathomics, cholestoma. And what I found interesting was on the dental part itself, there's a lot of image recognition and image analysis work going along dental imaging. And I want to see if they have joined us and want to give them an opportunity to summarize this for us.
Yeah, definitely. So the articles that I decided to focus on were, more otolaryngology specific and less of the dental specific. I mean, there is a lot of work being done within the imaging space across otolaryngology and the dental field. Like a lot of people had mentioned previously, there's a lot of predictive modeling utilizing radiomics data, but the ability for that to be translatable into the clinic is something still that needs a little bit of work. So specifically the way the questions are being posed and the usefulness of the output predictions and actually changing management for the patients, thinking about, prospectively once you actually get that additional information. The specific studies that I focused on, especially within the fields of neuro-otology and also within the fields of, head and neck oncology, are more of these real-time feedback mechanisms in which, just like in gastroenterology, being able to develop a imaging based artificial intelligence solution to identify particular lesions. Similarly, being able to identify particular structures intraoperatively. The head and neck region is a somewhat complex anatomical region. So being able to have real-time feedback for a surgeon to identify cholesteatomas, to identify particular structures in which you need to be extra careful about. This is going to be something that's going to be directly actionable and directly can be directly utilized by a surgeon by providing that real-time feedback, especially for that study that I highlighted for the cholesteatomas. That outperformed, while it couldn't outperform a formally trained neuro-otologist, it can outperform a general otolaryngologist. And just being able to provide that real-time feedback intraoperatively, even if it can't outperform a formally trained neuro-otologist, can increase the speed in which the operation can be performed. Because if you have that feedback, that it increases your confidence in what you're actually seeing, and that allows you to do the operational more quickly and more efficiently, and not have as much hesitation during the procedure itself. And additional, just to touch on the dental imaging a little bit, a lot of reconstruction planning is being, artificial intelligence has been utilized to develop better reconstructive solutions and ablation solutions for, when you're going in to do a, segmental mandibulectomy and knowing where to cut, how to cut, and having a pre-planned reconstructive option from where you're sourcing your flap, so your osteocutaneous flaps from, so that you don't have to do as much intraoperative kind of troubleshooting, as they say, when you already have these more structured and optimized plans that have been developed through the artificial intelligence solutions.
Well, thank you, Nathan. Thanks for the great summary, and thank you for your contributions. Oncology, again, a specialty that has been leading for quite a few years. The summary was provided by Dr. Ahluwalia and Shreya Saxena. So 214 publications. So while most of the publications saw a dip, oncology maintained the number of publications year over year, or compared to last year, I should say. Again, a lot focused on precision diagnostics and therapeutics. The oncology, immuno-oncology treatments. Of course, there has been a big focus on pathomics or radiomics for diagnosis, for prediction, for management of these patients, and increasing number of publications related to radiotherapy, focusing on how to use brachytherapy or otherwise. And this again has been maturing. This space also has been maturing, where we see the level of publications, not just the number, but the level of publications and the maturity of the research work has expanded quite substantially. I'm not sure if we are joined by Dr. Saxena or Dr. Ahluwalia. If you're there, feel free to summarize for us. All right, maybe we'll come back. Ophthalmology was provided by Dr. Sumit Sharma, 82 publications overall. A lot focused beyond diabetic retinopathy screening into clinician decision support. So looking at how you can provide clinician decision support, especially for tools that are related to retinopathy, but helping clinicians make those diagnoses. And what was very interesting was the publications that are related to use of auto-ML. This has been an evolving field where it's either low code or a simple way of running multiple algorithms. So AutoML was a big focus for ophthalmology publications this year, and maybe an opportunity for other specialties to look into and see how that can be done, at least for initial level of publication or research work. Pediatrics, we for the first time had a section related to or a review provided for pediatrics, thanks to Dr. Nijan and thanks to Dr. Animesh Tandon. They had 25 publications. There were a lot of journal reviews, imaging, radiomics, and radiation exposure based publications. Again, a big focus on high-risk physiologies, which were related to trauma and sepsis. Allergies, it's a distinct component of pediatrics as a specialty. So quite a few publications related to allergies, of course, cardiology, and then some of the pediatric neurological disorders, especially autism and ADHD. I do see Dr. Tandon here, so I'll let him summarize it for us. So thank you for joining us.
Yeah, hey everyone, and thanks Piyush for the invitation. I think a lot of the pediatric subspecialty stuff was in the relevant subspecialty reviews, but I think high prevalence or hard to diagnose diseases or rare diseases is what pediatrics is all about. And so I think a lot of the focus was on how do you use data to catch these rare diseases. ADHD and autism spectrum, I think, is huge. Pediatric imaging, as with everything imaging, I think because of the way the data are structured, are helpful for AI analyses. I think the biggest challenge that pediatrics faces is low numbers and scattered data, and then clinical heterogeneity. And so all of those limit the ability of these techniques to be used. But I think as people realize the power of having data collated, I'm hoping that as a field, we can move towards bringing some of those data sources together. And Huang, unfortunately, is stuck in the lab, so I don't think he'll make it. But
that's great. Thank you, Dr. Tandon, for your contributions. Your great summary. Psychiatry, again, a field where a lot of AI is being applied and researched. Dr. Amit Anand and Jungwon Cha provided us with a review, 74 publications, continued use of deep neural networks and CNN. That's what we saw this year. Again, some on the imaging and some on the EEG captures that they had. A big focus on NLP, use of NLP to understand EHR data and either pick out diseases or the trends for different disease states, but also social media data. So psychiatry is unique, where they have used social media data for diagnosis of various disorders or to see and assess the severity of these disorders. So these are continued trends and growing trends because of newer NLP applications and their use in this particular field. Of course, the challenge cited over there is about bias. When you create these algorithms, the data sets might be biased inherently. And again, you're going to develop these algorithms amongst vulnerable populations, the issues of consent, the issue of application of AI. Those are big challenges for this particular healthcare specialty. Pulmonary, Dr. Srinivas Mumadi provided us with the review of 21 articles. Interestingly, sleep medicine is taking over, and there were a lot more articles related to sleep medicine, and the first RCT that was included over there. Obstructive lung disease or COPD or asthma and tuberculosis related, especially imaging based models continue to be researched, but it's interesting how sleep medicine is coming to the forefront. And then the concept of electronic noses, so using sensors and then sensor derived data feeding into various ML or DL models for for making diagnosis. So the concept of electronic noses seems to be getting grounds in research too over there. Radiology, again, a specialty that has been at the forefront of research and publication related to AI and healthcare. Dr. Cywinski provided us with the review again this year, 318 publications, heavily focused on radiomics and radiogenomics. 23% of those were related to that. And we think about the different areas of the body. It's brain. There are a lot of brain-related MRIs and CT scans. We have seen a lot of FDA-approved algorithms related to that, related to strokes that have come about. So a lot of work and a lot of publications related to the same. And of course, then the chest, breast, musculoskeletal, and liver top the list. MRI continues to be the top modality, imaging modality, but the PET or the PET studies are also increasing. And as I mentioned, this is one particular healthcare specialties where there are already FDA-approved algorithms in place, and that continues to grow. The recommended read over there was Upstream Machine Learning and Radiology. An awesome read, would highly recommend reading that. Moving on to surgery, a very interesting year for surgery. So this year, the review was provided by Dr. Gaith Habib, Noor Abdullah, and Dr. Christopher Witt. There were a total of 84 publications. Again, amongst the subspecialties of surgery, general surgery, urology, vascular surgery, transplantation, and spine surgery were the key ones. A special shout out to urology, because I saw a lot of urology publications. They did really good. And I do see the co-authors here, so I will let them speak towards it. But I saw some publications related to robotic surgery, surgical planning, and optimization, similar to head and neck. And kudos to focusing on education. So, Dr. Abdullah, do you want to make some comments and provide us with a summary there?
Of course. Good evening, doctors. Thank you so much for this opportunity. As you said, like AI, there has been, much hype about AI this year, especially in urology, which is a field, known for embracing, developing newer technologies, as you said, like lasers, robotic surgery, etc. And many of the publications we actually reviewed were, theoretic papers, but we also saw that this year there has been interest in, studying the possible applications of AI in urology into basically 4 areas. 2 of them, the diagnosis and the prognosis of kidney cancer, bladder cancer, as well as prostate cancer. And we saw many articles tackling surgical planning, optimization, automatization, which was helpful for patients, for attendings, as well as trainees and residents, because there was also a hype around 3D models, helping trainees getting better at what they do. And I want to say that, especially at the Cleveland Clinic, along with our collaborators, we had the chance to tackle the subject of the use of AI in renal scoring of kidney cancer. And we were able to conclude that AI can significantly predict in a better way than what a human would do the perioperative outcomes of partial nephrectomy, as well as the oncologic features and outcomes of kidney cancer. And there was also a big challenge, AI challenge, called the KITS 2019, and now we have the KITS 2021, which is a worldwide AI challenge, which is available online, and we have the publicly available data scans, CT scans for kidney cancer, which has stimulated a lot of research in that area and encouraged other people to develop models, especially tackling kidney cancer issues. And we have been cited for more than 250 times. And we hope that in the upcoming years, we're going to see a lot of work, especially when COVID, will give us a break.
That's great. Thank you for summarizing that. Thank you for your contributions. So much gets facilitated when you provide open source data access and create challenges around that. So thank you for leading that work, and thank you for joining us today.
Thank you.
All right. Of course, there were a lot of other publications in different specialties that are enumerated over here. We continue to grow our reviews for all the different specialties. So it's also a call out to other specialists who would want to contribute for the next years. But we'll continue to grow and expand and provide in-depth reviews for these specialties where tremendous work is going on. So in conclusion, the trends in publications were maintained, although there was a slight dip compared to last year. There is a lot of work that is going on in guidelines for application, interpretation, and implementation that is being developed. Radiology and oncology, as you can see, continue to lead. Image-based models are still the large focus, although with improved language models in AI, but related publications and research work is increasing. Special shout out to GI, urology, ophthalmology amongst the fast adopters and catching up and growing very rapidly. And then there is some evidence that amongst different specialties, the level of models or the maturity of these models is definitely increasing. So not just about how much research is going on, but also about the maturity of some of these models that are now being implemented and then subsequently undergoing RCTs or further evaluations. And just like last year, I would like to summarize this by saying that we learned a lot through this year, and sometimes through the year you can't see the value of what you're doing, but when you come out on the other side, you learn that a lot was done in 2021, which was of great value. And thank you to all the contributors for this. And we will of course follow up next year with another great year in review. Our publication is available through ResearchGate. And I'm going to open the forum. We have a few more minutes left. I see already some members saying they would want to assist. We'll definitely leverage your help with this. But any other comments, questions, or suggestions that you might have? Just have a few more moments here before we wrap it up. All right, thank you everyone for joining us. Until next time, please stay tuned. Use our various different mediums and channels to stay updated and stay connected. Thank you very much. Take care.